name is Alyssa Davis. My program is Allied Health, Nutrition, and Dietetics.
The name of my program at Loma Linda is Emergency Medical Care, and the field that we work in is Emergency Medical Services.
My name is Blake Christensen, and I'm in occupational therapy.
As a group, we came here to teach people about basic health, so we had some health fairs, and we also got to run a small camp for the local kids. My role here was to train people in EMS, the local healthcare providers, and then to teach kids about basic hygiene, splinting, and bandaging.
I have been part of the nutrition team. We have been collecting data, doing nutrition assessments for the kids. At the health fairs that we did in Umuchi and the Floating Islands, we did nutrition assessments on the kids, so physical assessments. We measured them to see their height, their weight, their head circumference, to see their growth and development, and also doing some group education for them.
So my role in the summer camp was to help children and adolescents participate in playful activities such as obstacle courses, team building exercises, and it was wonderful because you see this wide range of age groups come together, and we were able to practice a lot of stretching techniques and strength training. The second day at Lake Titicaca, we assessed range of motion, strength, and balance. We're just observing how the kids were functioning in everyday activities.
This trip has contributed to my education and my career, both in helping me just to be able to go into a different culture and be able to figure out, what they have going for them. We did a little bit of EMS training here in Peru, and from the training that I received at Loma Linda, we were able to transfer quite a bit of that over here.
I think it's a good experience for the culmination of my education, and then also as I'm starting into my new career as a registered dietitian. I feel like it has helped me practice for sure, some of the things that I've learned in my program.
It's real-world experience that I would not get back home. It's not hospital-based, it's more community-based, but it's international. And when you're international, there's all these different customs that you have to learn and you have to roll with because it's different.
When we visited the local health post here, it was very interesting to see, and it was really helpful in understanding what the health needs are in Peru.
We learn about cultural sensitivity.
You're out of your element, learning as you go.
So for example, we were helping with a summer camp down here at the ADRA site, and we had to do nutrition education for the kids. And so one thing that they have down here that they underutilize because they sell it, they export it, is quinoa.
When we went, our focus was on the emergency medical services part of it, and they don't have an EMS service at all.
Quinoa has a lot of protein, and so what we did was we made a way for quinoa to be cool.
The people here really wanted to learn about trauma and shock treatment, and also how to move patients without a gurney or backboards.
We came up with a way for quinoa to be really cool for the kids. So we came up with this superhero, Super Quinoa Man.
We were able to take the skills that we've learned from Loma Linda and teach them, how to make a backboard out of a blanket and some boards.
And I think that's part of being a clinician and being part of a hospital team, is that it's something that you can never plan for. It's something that you just have to jump in and do.
We were able to teach them how to assess a patient in an emergency situation. We were able to show them how to manage and prioritize their patients so that it has the best outcome for all.
It was a lot of fun watching the kids get excited about quinoa, of all things. It was a really cool experience, and now I think that will be in their brain, like, oh, quinoa. You know, they won't forget that. So that was one of the ways that we kind of adapted just a regular nutrition education lesson for this population of children here.
One word I would describe this trip is educational.
Indescribable.
Humbling.
It's definitely something that you cannot read from a textbook.
I didn't know what to expect when I was coming out here.
When we came, we ended up doing a lot of things that I didn't think we were going to be doing, and I ended up doing a lot of things I didn't think I was going to be doing.
Also, just a lot of the things that we've done and a lot of the experiences with the people, it's just hard to describe in one word.
You would have to just come out here and experience it.